Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. Today I wanted to talk to everybody about idiopathic diseases in general and urinary incontinence specifically, right? So there's a huge problem in the United States right now with idiopathic diseases, right? So the leading causes of medical expenditure in the United States are almost primarily idiopathic diseases, right? So cancer, autoimmunity, obesity, cardiovascular disease, diabetes, all of these diseases that you hear about all the time are considered idiopathic, right? The majority of those diseases are considered to be idiopathic. So idiopathic means that there's no specific, clear underlying cause for the condition, right? So if you look at the obesity numbers, about 70% of the United States population is either overweight or obese. Only 5% of those people have some type of underlying genetic anomaly that may be leading to a difficulty with keeping weight off, right? So 95% of the 70% of the country that's obese, according to our medical system, don't technically have anything wrong with them. And this is just a bunch of baloney. So unfortunately, and this is hard to swallow because it's so screwed up. But the way that it works in typical mainstream medicine, so if you're going to a doctor's office and using your health insurance, that is what I consider to be mainstream medicine, because if you're using your health insurance, the system that your medical process goes through is solely dictated by the insurance companies who are reimbursing you for the codes that you put down for what you did. So you have some medical person or non-medical person, and I've been a doctor for 10 years, you guys have been a doctor for physical therapy for 10 years. I've spoken to lots of insurance companies on the phone, and half the time you get somebody that's not even a medical practitioner, and the other half of the time you get somebody that has no idea about anything in your line of medicine, right? So as a physical therapist, a lot of the time when I get on the phone and talk to people, I'm talking to, again, either a non-medical person or a nurse practitioner, somebody that has absolutely no idea what's going on in my realm of medicine, somebody that has no idea anything personal about my patient. They've never seen the patient before. So you have somebody that has never seen your patient, has no idea what's going on except for things that have been written down, has no legal responsibility towards your patient, and yet they're the ones that are more or less in charge of what type of treatment gets approved for the patient, how many treatments they get. So it's just really disgusting. So the way that typical diagnosis works in a doctor's office is you go in, you give them a bunch of subjective things, right? Depending on their brain capacity, they may remember it or they may need to look in a book or on the computer, but all they do is match your subjective symptoms as closely as they can to a list on the computer or a list in the book, and then they give you whatever pill is supposed to stop those symptoms, right? So pharmaceutical drugs are approved if they can reduce one symptom by a significant amount, right? By a certain percentage. So, and they're never targeted at fixing the problem, right? So that's why so many people that take statins or diabetes drugs, they still have issues with their blood pressure or their blood sugar because the pill is not targeting the underlying reason that the problem is happening. It's targeting symptoms. So it's targeting the vasculature itself with statins and the brain, obviously. Diabetes drugs targeting the brain and insulin, but they're not targeting the reason that those things are a problem in the first place. So if you read Dr. Peter Attia's Outlive book and listen to some other good podcasters and read other good medical literature, it's very, very obvious that people that eat well, so that do not eat processed foods, which is about 75% of the food in the grocery store is processed, right? So if you don't eat processed foods, if you exercise, and if you just more or less take care of your body, you live an average of 15 extra years compared to people that don't do that stuff, right? The average age of death in some Asian countries is over 10 years longer than it is in the United States, and one of the primary reasons for that is their government does not allow their food to be poisoned. So 75% of the food in our grocery stores you can't really consider to be food. It's basically FDA approved poison, right? So anything that has been through the processing process has all these chemicals in it, right? I really didn't fully come to grasp this, you guys, until I started living in South America. So after I played Division I ice hockey in college, I lived in Patagonia, Chile for a decade, right? I spent 8 months out of the year in Chile, and I spent 4 months out of the year in southwestern Alaska, and I was a fly fishing guide. And one of the things that just blew me away, right? So I grew up in Boston. One of the things that just blew me away when I got down to South America was how freaking fast the food went bad, right? So I'd go to the grocery store and you'd get bread, and the bread would be stale in like a day or two. You go to the store and get fruit, right? Everything down where I lived way out in the middle of nowhere, was all locally grown. Everybody subsistence lived. Hardly anybody in the town, the tiny little town near where I lived of about 800 people, hardly anybody had ever had a bank account, had a car. They hadn't been more than 50 miles from where they lived. So people down there just did not have the problems that we have in the United States because their food wasn't filled with poison, right? They were growing their own food. It wasn't going through this big manufacturing process. That's the same reason that a lot of the Asian countries have a much healthier population and have a longer lifespan than the US, because they don't eat as much crap, right? So the way that, I guess one way to think about it as far as processed foods go is if you start putting a little bit of water in your gasoline for your car, bit by bit, your car engine is not meant to burn water. It's meant to burn gasoline, right? So the car tries to break the gasoline down and use it, it can't. So the water starts creeping in and filling up all the nooks and crannies in your engine, and your engine can't use it, it can't burn it, but it's taking up space. That's the same type of thing that happens with our body when we eat processed foods, right? So one example is folic acid, right? So folic acid, you need to have a certain on-off of the let's see if I can remember it, MTHFR gene. Yeah, MTHFR, the MTHFR gene. You need to have that gene either on or off, I can't remember, but what I can tell you is that about 40% of the United States does not have that gene in proper mode to break down folic acid. So folic acid is loaded up in basically any non-organic grain that we get in the United States. The United States is one of the only countries in the world that allows folic acid to be put in the food. 50%, 40 to 50% of the United States population cannot break down folic acid. Their body literally cannot do it. Folic acid is not found in nature in a single place. It's a completely man-made, manufactured thing, right? If you can't break down folic acid and you're eating a lot of processed carbohydrates, that is basically like eating plastic all day long, right? Your body can do nothing with it, so it's taking up space in your body, it's causing inflammation because the body's trying to break stuff down that it can't, so it has to try extra hard to do it. It's using up energy from the autonomic nervous system that it could be using for other things like maintaining hormone levels, maintaining neuromodulator levels. So our body goes into an energy deficiency and an energy crisis, right? So our autonomic nervous system only has a certain amount of juice to use. So just think about it as like a well, like we have a well of autonomic nervous system power that we can use. And we want to maintain that well with as much reserve energy as we can, because if anything happens to us, like we get into an accident or we get an injury or whatever, our body needs to be able to have a backup store of energy to put towards healing. If you're running on an energy deficiency, which the vast majority of the United States is, 70% of the population is overweight, that does it to you right there. So at least 70% of the United States population is running on an energy deficiency. That means if anything extra happens to their body does not have the resources to properly heal and to function the rest of the body, right? So it has to make hard decisions on what to do. Is it going to heal? Is it going to take care of your blood pressure? Is it going to take care of your insulin levels? Different people present differently when they have problems with this stuff, right? So the more non-usable shit that you put into your body, the more energy your body has to use to try to get rid of it. And if you do this on a consistent level like the vast majority of people do for life, your body has literally 0% chance to function properly or to fight off disease. That's why 50% of people at the age of 65 within 5 years of breaking their hip are dead. That's an insane stat, right? And it's not because breaking your hip is typically a life-threatening condition, although it can be, but it's typically not. The reason is that most people at 65, because of age and health, they're not in good health. They've not taken care of themselves, they've not exercised, they've not eaten well, and they've not done things like dry needling and joint manipulation to help maintain autonomic nervous system homeostasis. So if you're living in an energy deficiency and you have a big traumatic event like breaking your hip, your body does not have the resources to recover. So then all your systems start to shut down, and you just go on this downhill slope towards death, right? So autoimmune diseases, including incontinence. Incontinence is one I wanted to talk about specifically, right? So, sorry, not autoimmune, idiopathic diseases. Autoimmune diseases are, for the most part, considered to be idiopathic, right? So if a doctor in an office can't match your symptoms to a specific drug that they can give you, and the most obvious objective evidence right before their eyes doesn't lead them to an obvious answer, your condition's basically considered to be idiopathic, right? So if there's not like one single test that can show what's going on with you, and there's not like one or two drugs that can help you, your condition's considered idiopathic, which is just nonsense. If we eliminated the majority of added sugar and other processed crap in our food, we could get rid of most idiopathic autoimmune diseases in the United States within 2 generations, right? The problem with that is that the people that run the country and make all the money, they're the ones that are selling drugs to people and making their living off of the United States population being sick. So it's really just a disgusting process. But anyways, there's so many people out there that are living their life with conditions that are easily fixable. And this is what really bothers me, right? Take urinary incontinence, for example. With urinary incontinence, unless you're one of the few unfortunate people that have some type of underlying structural condition or some type of significant underlying pathology like cancer, prostate cancer, severe cardiovascular disease, right? Unless you have something significant structurally wrong with you or neurophysiologically wrong with you and you're having incontinence, you're suffering for absolutely no reason whatsoever, right? The problem is that mainstream medical doctors have been taught in medical school, if there's not a pill that can obviously fix your problem, you're screwed. And it's really crappy, right? So the reason that people have autoimmune diseases and idiopathic diseases, for the most part, is that their autonomic nervous system has departed from homeostasis, and they have energy and nutrient deficiencies in the body from eating crappy food and from not exercising, right? I'm not going to talk about the exercise and the eating diet and anything like that. If you want some really good information on that, check out Dr. Rhonda Patrick, Found My Fitness podcast is a really good one. Dr. Peter Attia, the Drive podcast is a really good one. Gary Brecka's The Ultimate Human podcast is a good one, and Andrew Huberman's The Huberman Lab is also a good one. So those are some of the ones that I like to listen to. So anyways, as far as the autonomic nervous system goes, right? So we're going to leave exercise and eating well and all that stuff. Well, I'm not going to talk about that, although it's super duper important. As far as things that physical therapists can do for their patients to regulate the autonomic nervous system, dry needling combined with joint manipulation are the two most powerful tools that we have, right? So let's start with joint manipulation. So I will put up a little educational video in the middle of this looking at some of these structures that I'm going to talk about, but just to show you guys a little bit of what's going on. So if we're looking at the torso here and the pelvis, we have something in our spine called the sympathetic chain, right? So the sympathetic chain is basically our autonomic, the sympathetic portion of our autonomic nervous system outside of our brain. That chain sits just like my two fingers there on the anterior lateral portion of the vertebral bodies, and it goes from the brainstem all the way down to the coccyx. So the sympathetic portion of the chain is typically considered from the stellate ganglion, which sits right in front of the first rib, right? So the stellate ganglion sits right in front of the first rib, and that's at C7T1, and that typically is considered to go down to like L1 or L2, is considered the sympathetic portion of the sympathetic chain. And then when you get into the upper cervical spine, so right near the brainstem, like the subcranial spine, C0, 1, 2, you got the cranial nerves 5, 7, 9, and 10, right? So the trigeminal nerve, the facial nerve, the hypoglossal nerve, and the vagus nerve, those are very, very parasympathetic dominant cranial nerves. The trigeminal nerve is part of the trigeminal and cervical complex in the brain, which has a lot of parasympathetic ganglia. So as far as joint manipulation goes, if we have that chain sitting here that's going from our first rib all the way down, and any of these vertebrae get rotated out of place, that's going to put direct tension and stress on the sympathetic chain, which is going to basically, as directly as we can, stimulate the sympathetic portion of the autonomic nervous system to elevate more. So remember, the typical human response to mental or physical stress, strain, pain, or trauma is sympathetic autonomic hyperactivity. It's just the way that the human body responds to living, basically, is to elevate sympathetics. All right, people, so let's look at the sympathetic chain here, right? So what I was talking about with the skeleton there is the stellate ganglion is right there. So there's the first rib, there's the stellate ganglion, right? So that's typically considered to be the top part of the sympathetic chain. And then if we go down and we zoom in a little bit more and we do the multi-select here, this whole thing that's the sympathetic chain, right? The sympathetic trunk. So that's typically considered to be the sympathetic portion of our autonomic nervous system, and it goes down into the lumbar spine like L1 or L2 typically. And then if you look, it continues down into the sacrum and the sacral plexus, and this is the aparasympathetic portion of the sympathetic chain. And then if you go back up, all the way up, see, it's all connected, and it goes all the way up into the brainstem, right? And that is the other parasympathetic portion of the autonomic nervous system, right? So the portions that we can target outside the brain are due to the cranial nerves coming out of the foramen magnum and the sacral plexus S2 to S4. Now, what I mentioned is, as far as manipulation goes, if this is the sympathetic chain, right? If any of these vertebrae get twisted out of place, that sympathetic chain gets directly aggravated, right? And if we put in some of the muscles, if we put in the psoas major here, right? Look at where the psoas, that was the minor. That was the wrong side. Here we go. Look at the psoas major here, right? So the psoas major is a massive muscle that goes from the anterior lateral portion of your lumbar vertebral bodies down to your lesser trochanter. And there's tendrils of that sympathetic chain that go right through the right through the psoas major, right? So if that psoas major gets tight and hypoxic and the joints get out of place, which they do concomitantly, that's going to put stress and strain directly on that sympathetic chain, which is going to aggravate the sympathetic autonomic nervous system into further sympathetic autonomic hyperactivity, which is going to inhibit your body's ability to ever function normally. So spinal manipulation is very, very healthy, healing, and important if you have it done by the right person, especially if you combine it with dry needling, right? And then the other thing that I may or may not have mentioned about the sympathetic chain is the sympathetic chain has all these plexuses that come off of it, right? So that's the renal plexus. Here's the core. There's the suprarenal plexus. I believe that's the greater splanchnic nerves, right? So if we go back and we just click on this one here, the renal plexus, right? These plexuses that come off of the sympathetic chain are all organ control systems. So we have the hypogastric plexuses, we have the renal plexus, we have the celiac plexus. All of these plexuses innervate things like our aorta, our heart, our kidneys, our liver, our intestines. So if the sympathetic chain gets aggravated, that's going to aggravate the plexuses. That's going to aggravate the organs, the autonomic nervous system, and the vagus nerve itself, which is going to put our body in a horrible position to be able to function normally, and it's going to start sucking up energy out of that autonomic nervous system well. So as far as simple tools that physical therapists can use, dry needling combined with joint manipulation are the most powerful tools we have at our disposal to remove tissue pathology, restore normal alignment in the spine, and restore homeostasis to the autonomic nervous system, which is the overall key to health. If our autonomic nervous system is too dysfunctional, so the autonomic nervous system is like a seesaw, right? So if the sympathetics go up and the parasympathetics go down, then our organ and our brain communication gets disrupted, right? So the vagus nerve is the nerve in the body that innervates the most unique structures, right? So the vagus nerve is the 10th cranial nerve, comes out of the brainstem, goes down kind of on the inside of your neck, near your esophagus, and then it goes down and innervates all the organs, right? The kidney, the liver, the lungs, the heart, the intestines. So the vagus nerve is like our interoceptive awareness regulator. The primary function of the vagus nerve, and this is a unique thing about the vagus nerve, is so all nerves have afferent and efferent fibers, right? So the afferent fibers are sending signals to the brain, efferent fibers are sending signals to the muscles and stuff. The vagus nerve is 80% afferent. So 80% of the vagus nerve fibers are made to tell the brain what's going on with the organs, so then the brain can properly interpret those signals and then send regulating signals back. The more the sympathetics go up, the more the parasympathetics get inhibited. The most parasympathetic structure in the human body is the vagus nerve. That's going to be the most inhibited structure. So what that does is cause all sorts of problems, right? So if the vagus nerve gets inhibited, our communication highway between the organs and the brain gets inhibited, and the brain stops receiving the proper signals about what's going on with the organs. So if the brain's not receiving the proper signals, it can't send the proper corresponding regulatory signals. And when we have organ dysfunction or tissue pathology anywhere in the body, that inhibits certain corresponding areas of the brain. So if the body is trying to process a whole bunch of crap that we've been eating all the time, and we have a whole bunch of tissue pathology in the body, all those things are sucking energy out of the autonomic nervous system well that we could be using for regular everyday to-day function, right? So as far as manipulation goes, if the joints are not in neutral, that sympathetic chain is going to have constant chronic aggravation going to it, which is going to chronically piss off the sympathetic portion of the autonomic nervous system, which is the underlying problem for the vast majority of idiopathic impairments, including incontinence, right? So if you're having any type of incontinence, I don't care if it's just leaking when you exercise or at night or whatever, the stupid night catheter commercials I hate. The reason that you're having incontinence or other idiopathic diseases, if there's not any obvious underlying problem, is that your autonomic nervous system is in a state of chronic dysregulation in the sympathetic direction. Almost all the time it goes in that direction, and your body just starts to dysfunction. The hypothalamic pituitary adrenal axis gets dysfunctional, the gut-brain axis gets dysfunctional. Remember, all these things rely on the vagus nerve to connect them. the pituitary starts pumping out abnormal hormone concentrations. It's just a big problem. So what dry needling does is every little tiny piece of tissue pathology that we remove from the body puts energy back into that well for our body to use for things that it really needs to do, rather than trying to deal with tight, aggravated muscles, right? So chronic sympathetic hyperactivity leads to body and brain-wide inflammation, right? So we can see these pro-inflammatory markers. The liver starts to produce some of them, like C-reactive protein, interleukin 1, interleukin 6, right? And then we also have anti-inflammatory markers like interleukin 10, tumor growth factor beta, although that kind of sounds like a bad one, that can be a helpful one in certain concentrations, right? So overall, with sympathetic autonomic hyperactivity, our brain and organ communication gets shut down, our intestinal motility goes down, our gut microbiome gets fouled up, right? All of this stuff has a large portion of control based in the vagus nerve. So with dry needling, just the fact of removing pathologic tissue from the body depresses sympathetic autonomic hyperactivity. If we can concomitantly at the same time target the parasympathetic portion of the autonomic nervous system, again, which would be the cranial nerves, the sacral plexus, S2 to S4, including the pelvic floor muscles, which are innervated by S2 to S4, the upper cervical spine again, the ears where the vagus nerve innervates, and the concha, the symbiconcha, and the inside of the tragus, and then also the trigeminal nerve in the face, and the suture lines in the head are very parasympathetic to needle, right? So the trigeminal nerve in the face, you get the otic ganglion going here through the hole in your jaw. That's a really good place to stimulate the trigeminal nerve. And then again, if you add spinal manipulation and joint manipulation to take stress off of that sympathetic chain, as far as what physical therapists can do and as far as what medicine can do in general without you doing something for yourself, like exercising and eating well and changing your diet and supplementing, taking tissue pathology and stimulating the parasympathetic part of the nervous system, which is the part that's depressed, can bring the autonomic nervous system back to enough homeostasis where your body will break out of its cycle of being inhibited from using the healing abilities that it knows how to do, right? So again, with incontinence in specific, the most parasympathetic structure in the body is the vagus nerve. The most parasympathetic dominant group of muscles in the body are the pelvic floor muscles. So the problem is not that your pelvic floor has just like forgotten how to function somehow. That's not the case. It's that it's being inhibited from doing so. The pelvic floor, when the sympathetics are too hyperactive, just like all other skeletal muscles, they get tight, short, hypoxic. Lack of oxygen is what cancer uses to grow. It's what all sorts of autoimmune diseases like. So oxygen kills bad stuff in our body and helps normal things happen. A lack of oxygen helps all sorts of problems, right? That's why antioxidants are good, right? Those oxidative factors happen when oxygen is not around, which happens when the sympathetic nervous system is too high. So it's not that the pelvic floor isn't working, it's that the sympathetic nervous system is too high, the parasympathetic nervous system is too low, and you have no cross-communication talk between both halves of the nervous system. So your pelvic floor is just in a chronic, constant state of contraction, right? Which is why the medicine that's given for urinary incontinence is typically an antispasmodic of the detrusor muscle, which is around the bladder. Dry needling actually treats the cause of the problem, or at least a cause of the problem, which is tissue pathology and autonomic nervous system dysregulation, which is the underlying cause of, or a big underlying cause of most autoimmune diseases, all idiopathic diseases, right? So the answer to all these problems is not a pill. It's never going to be. The human body is the most complex structure in our universe that we know about, right? It's multifaceted. You need to look at diet, you need to look at activity level, you need to look at tissue pathology, and we need to naturally, at the same time, do whatever we can to help push the autonomic nervous system back towards homeostasis. Once we can push the ANS back towards the range where it can self-regulate, the inhibition goes away, it breaks out of its protective cycle of sympathetic activity, which is how our body protects itself, and normal processes can start to function again, right? This process can be made much more effective when people are helping themselves by doing those things that we talked about. But as far as things that physical therapists can do for patients for idiopathic diseases, which again are for the most part nonsense, they're not idiopathic. We know what they're from. I just told you what they're from, right? It's very complicated. There's a lot of different things that go into it. So by trying to fix these things with a specific pill is never going to work, right? So these really cheap, very effective, natural treatments are very, very helpful for all this stuff, including urinary incontinence. I fix decades of urinary incontinence in patients in a couple of treatments all the time, right? It's just because with the needling and the joint manipulation, you can regulate the autonomic nervous system much more forcefully than you can with other physical therapy treatments. Let me know if anybody has any questions about anything. Remember, you can check us out at intricateartseminars.com. Check out our blog page on our website. I got a bunch of blogs up there, and if you're watching this on YouTube, you know where to find us. Thanks.